Wellesley Community Health Centre, which is a primary care nurse. So I triage patients for my docs and my nurse practitioners, as well as do my own nursing visits. I would say the primary responsibility or role of a nurse is to advocate for their patients. So the ACP piece fits right into that whole advocacy piece, because how better to care for your patients and help them with what their wishes are than to speak to them about advanced care planning. So we had a numbering system. We had SDM 1, 2, 3, and 4. 1 was that they'd been given the package. 2 was that a nurse had just quickly gone over the list of substitute decision makers as put forth by the government. Number 3 was if they agreed with it and they had the conversation with their SDM or their POA, as it would happen, then that would be a number 3. And number 4 was if they actually brought in a copy of their POA, if they had one. Not many people get to number 4 because they're comfortable with the hierarchy of the SDM. And as long as it had the conversation with the person who was in their hierarchy that was for them, then it was all good. So we have probably 175, 180 of our patients who are at that 3 or 4 level now. No difficulties at all. We have good therapeutic relationships with our patients. It's never been uncomfortable or difficult. I think there's a few reasons why it's important. Advocacy, number 1. We want the best for our patients. And who better to do that but your primary care office, your physician, your nurse practitioner, your nurse, your reception, because they know you. They know you now in your health, in your prime, in your non-sick now time. So what better time to talk about is when you are not stressed about a diagnosis, or why would you wait until there's a crisis or a critical illness, or it's too late cognitively or mentally, physically, emotionally to make those decisions. You want to make them thoughtfully. You want to make them with lots of time to decide what things you want to happen, and you also want time to go to your SDM and have a discussion about it. So primary care to me is a no-brainer. Like, that's pretty much the place you should be talking about advanced care planning.